And welcome to this audio podcast. This audio podcast synopsis as part of the LabZtorm and Diggamount. This audio podcast synopsis as part of the Coppola and Storm and Labostics. This audio podcast synopsis this audio podcast synopsis as a part of a shipmo squad, and this audio podcast synopsis as part of a Storm Labostics production. Through this audio podcast, a look at in around an overview in as part of this chapter and where this looked and this where this audio podcast where this audio podcast overview will look at sort of a in around a sort of a more detailed look at in around works from a previous Storm Robotics audio podcast in around aspects pertaining to sickle cell anemia. However, where this audio podcast will go into the importance of considering estimated glomerular filtration rate, or eGFR health in sickle cell anemia, thalassemia patients, to better blood transfusion practices, and wherein this will be a collaborative. This is a collaborative between Hip Hop Gardens team in Southwest UK, or the May Gardens project in Southwest UK, the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDOS Group for Kids, social media platforms in the UK. This audio podcast will be as said, a synopsis. So so patients diagnosed, or those healthcare service users diagnosed with several chronic illnesses, or CIs, and throughout the audio podcast, the terminology chronic illness or illnesses will be abbreviated with CIs. Um, are the most sort of are the most are the most sort of intensive, or have been evidenced as one of the most intensive users of healthcare services, because the needs or requirements in around the sort of those healthcare service users with CIs are usually more complex and more complex than those of healthcare service users with single illnesses or ailments. And the number of healthcare service users with multiple CIs had increased from 1.9 million in 2008 to 2.9 million in 2018. So the aims of this is where collaborative review look to highlight the need or the requirement to consider estimated glomerular filtration health, or eGFR health, in sickle cell anemia or thalassemia patients or recipients, and as a way to better transfusion better blood transfusion practices. So in this works in 2000, and as part of this works, a little bit in around sickle cell anemia and thalassemia. So in around 2016, 2017, the National Health Service NHS screening for sickle cell anemia, and thalassemia program identified in around 274 neonates in the UK with sickle cell anemia, and a further 8,530 neonates as carriers. One investigation had evaluated sickle cell anemia care utilization over 16 years, or near 2 decades, from 2004 up to 2019, a duration in where treatment modalities approaches for young for young sickle cell anemia or thalassemia care for young sickle cell anemia or thalassemia populations had have changed significantly across across the sickle cell anemia genotypes. So, in around red blood cell transfusion practices, or RBTs, RBTs, in as part of one of the sort of additional abbreviations. Um, the affinity for red cells, or red blood cells, for oxygen is modulated by regional acid-base conditions to favor oxygen loading at the pulmonary alveolar capillary interfaces, as well as unloading at the tissue level. At present or currently, there are no clinically available fluids that have the loading or unloading and carrying properties of blood. So in looking at the decision to transfuse, considering that eGFR, estimated glomerular filtration rate, health and blood physiology of healthcare service users who may require uh, who, who may who may require RBTs, is important to achieving best practices, more so now than ever. But also because transfusing young healthcare service users, or transfusing those with SCA, sickle cell anemia, and or thalassemia, for example, um, is where is where in those healthcare service users with at the same time, where those have reduced eGFR, a reduced eGFR can have further can further compromise can further compromise kidney or renal pathophysiology over time. So, in around some aspect pertaining to transfusion alternatives, so research to understand and identify suitable transfusion alternatives, and indications to RBTs, or for RBTs, for healthcare service users with SCA or thalassemia and chronic illnesses, aligned to chronic illnesses, is important now than sort of more again more now than in the last decade. And there is also an importance to better appreciate eGFR health as a clinical factor in SCA or thalassemia recipients or patients. So, in around some conclusions as part of this synopsis, at least, feasibility and pilot and longitudinal investigations that look to compare different forms of treatment alternatives in a cohort of healthcare service users who would normally be prescribed RBTs, that whether in the longer term that they would advantage from other forms of treatment modalities, from other forms of treatment modalities are required. So, some terminologies that listeners can check out. and putting and those terminologies can where the terminologies can be used to identify some of the literature. So, for example, some terminologies include hematology, sickle cell anemia, nephrology, transfusion practices, and additionally thalassemia. So that draws this synopsis to a close. This synopsis is part of the LabZtorm and Diggamount. This audio podcast synopsis is part of the Cupola and Storm and Labostics. This audio podcast synopsis as part of the Shipmo Squad, and this audio podcast as part of a Storm Labostics production.